Thanks for coming back. Let's continue with those nursing implications. It is important that the patient not consume alcohol while on these medications or take other medications, including the over-the-counter medications, unless they check with their prescriber. It's important to note that rifampin causes oral contraceptives to become ineffective, so another form of birth control is needed during this time. Patients who are taking rifampin should be told that their urine, their stool, saliva, sputum, sweat, and tears can become a reddish orange, so that can even stain their contact lenses. Rifampin also interacts or inhibits the effect not just of the oral contraceptives, but quinidine, corticosteroids, warfarin, methadone, digoxin are oral hypoglycemics and can interfere with we can have significant interactions with the protease inhibitors or the NRTIs that we talked about in the HIV section. So pyridoxine may be needed to combat the neurological adverse effects that are associated with INH therapy. You're going to recognize that as vitamin B6, right? So oral preparations can be given with meals to reduce GI upset, but the recommendations are to take them an hour before or 2 hours after meals. Other nursing implications are that we want to instruct the patients on the adverse effects that should be reported to a prescriber immediately. So that includes fatigue, nausea, vomiting, numbness and tingling of the extremities, fever, loss of appetite, depression, or jaundice. We want to monitor for therapeutic effects. This is to see a decrease in the symptoms of TB, like the cough and the fever. This is another reason that TB is not treated quickly and that we do screening for it. It's that these patients with pulmonary tuberculosis usually they progress very slowly, and there's this progressive constitutional symptoms. So they just feel bad. They have malaise, they are anorexia, they lose some weight, they may get fever or night sweats. But chronic cough is the most common symptom. It can be dry at first, but it typically becomes productive with this purulent sputum, and bloodstreak sputum is common. So a lot of times this life-threatening hemoptysis, we can have it initially as a symptom and we can treat it, but sometimes the patient may not come to the provider to be seen, so it can be there and they can have very advanced disease. Dyspnea itself is unusual unless we have extensive disease. So they look chronically ill and chronically malnourished. So what we'd like to see is this decrease in these symptoms. We'll do lab studies. We're going to do culture and sensitivity. As I said, with the bronchial wash, we're going to do chest x-rays to confirm those findings. And we're going to, if we have a lack of clinical response to this therapy, then we do possibly have drug resistance. So it's really important that we monitor for the therapeutic effects, because remember, the length of this treatment is going to be over several months. If you have questions, as always, you know how to get a hold of me: email, text, call, or post it in the discussion forum. Then we have one more to do, and that is our antifungals. I'll see you over there.